Philip Veit founded and leads the private laboratory Dial Lab, a diagnostic laboratory for animal samples based in Belgium. He studied veterinary sciences at Ghent University, graduating in 1989, having won 2 awards for his thesis. Since then, Dr. Veit has worked in various veterinary roles, became a diplomate of the European College of Porcine Health Management in 2006, and completing a PhD which focused on the examination and storage of liquid porcine semen in 2007. Enteric diseases in pigs have a significant negative impact on production performance, as well as having huge financial implications. In this focus video, Dr. Veit explains the causes of enteric infections, their symptoms, and how they are diagnosed.
Hello, I'm Philip Veit. Today we will talk about enteric infections in pigs. There are several reasons for enteric infections in pigs. We have viruses like rotavirus, PD, TGE. We have several bacteria, they are listed there, and we also have some parasites. We will discuss them in different slides. First of all, we go to the viruses. And the most important virus, and it's the most prevalent virus in pigs, is the rotavirus. Especially in young piglets in maternity, we see 3 different types of rotavirus. A and C are very common. Sometimes we also find rotavirus type B. Typical for rotaviruses is that they destroy cells within the intestinal villi, and there the velocity are being shorter than normal. And short villi result in less absorption of nutrients and loss of liquids. So we have a watery diarrhea in those animals with dehydration. When we look at the intestines, they are congested, sometimes even transparent, because the intestinal wall is narrower than normal. How do we know it's rotavirus? Well, we look on the intestinal content by PCR, and we can determine the type of rotavirus. And we can also look at the typical lesions on histological examination. We see that the villi are very short compared to a normal intestine. Next to rotavirus, we have other intestinal viruses in pigs, like porcine epidemic diarrhea virus and also transmissible gastroenteritis virus. Those 2 viruses have the same mechanism of action. They shorten the villi within the intestine, therefore causing diarrhea and less absorption. Both viruses are capable of infecting older animals also, so the impact on the farm will be larger than in rotavirus infections. When we diagnose those infections, we also look at PCR on the intestinal content, or we can look at histological lesions with the shortened villi. Very important in viral enteritis is the fact that you need maternal immunity to protect the young piglets. So we have to vaccinate the sow or bring the sow into contact with the virus. Next to those typically enteric viruses, we also find enteritis due to porcine circovirus type 2. PCV2 is known as the cause of post-weaning multisystemic wasting syndrome, but it can also give enteritis, sometimes in weaners and fatteners mostly. We see a lymphoid depletion within the lymph nodes of the intestine, and you can also see on the slide that the intestinal lymph nodes are very swollen. And sometimes in the mucosa you can also see necrotic lesions. We can diagnose PCV2 by determining the copy number of viruses within the lesions, or we can look at histological lesions, seeing depletion within the lymph nodes. So, most important for viral enteritis are the viruses which shorten the villi. When we look at bacteria, on the other hand, they have other mechanisms to cause enteritis. First of all, we look at E. coli, the most important agent, bacterial agent causing enteritis in pigs. E. coli has to adhere to the intestinal cells, and then it produces toxins And those toxins stimulate the intestine to produce liquid, enzymes, minerals, all those things. So you get an animal which is dehydrated within its own intestine. Very important, you see symptoms of dehydration and diarrhea. We can culture the bacteria, we can type the bacteria to see if there are adhesion factors, toxins. And we also have to remember that whenever you have E. coli enteritis, that also stress factors are very important in provoking clinical disease. The bacteria can be there, but sometimes disease is provoked by stress symptoms or not enough maternal immunity, for instance. So next to E. coli, we also have Clostridium perfringens and Clostridium difficile causing enteritis in pigs. Both bacteria produce toxins, and those toxins work on the intestinal mucosa, making small deletions in the mucosa. Then you have loss of liquid from the intestine and less resorption of nutrients. There's also formed crust on those lesions, which impairs nutrient resorption. In Clostridium perfringens, we have two kinds of disease. We have neonatal enteritis, this is quite prevalent, and we also have mortality in older pigs due to overgrowth of the bacteria, for instance, when there is a feed change. We diagnose Clostridium enteritis by culturing the bacteria and by detection of its toxins, so that we can adapt our vaccination strategy to the results. In the next slide, you can see the results, the lesions of Clostridium perfringens type C. And you can see that those toxins produce a hemorrhagic bowel with small gas bubbles within the intestinal wall. So there is a lot of tissue damage which causes mortality of the piglet in this case. Another bacteria which destroys the intestinal wall is Salmonella. Next to the importance as a zoonotic agent, it also gives enteritis in pigs. Salmonella has to adhere to the intestinal cells. It invades the mucosa, and on that invasion there is a strong inflammation reaction of the body. And that inflammation reaction makes that there are lesions within the mucosa, lesions which lead to diarrhea, weight loss, poor body condition, and those things. It's an infection we mostly see in weaners and in small fatteners, seldomly in suckling piglets. The intestinal lesions are covered in a second phase with fibrin deposits, with a crust, so there is less resorption of nutrients to the blood. Diagnosis of Salmonella is made by culturing the bacteria from the lesions or from feces. We can also monitor the contact with the bacteria by serology, by detecting antibodies to Salmonella. Very important also is the diet which is given to the animals. It can favor or disfavor the bacteria itself, and also stress factors are important because in case of stress the intestinal movement is lower and the bacteria can adhere very fast. In this slide you can see the lesions of Salmonella, and you can see that the intestinal wall is really destroyed. You see ulceration within the intestine. The following bacteria, because there are a lot of them in enteritis, is Brachyspira. Brachyspira works on another way. It adheres in the colon to the intestinal wall, and it breaks down the barriers between the cells in the intestine. So you get loss of liquid within the large intestine. Very important and very pathogenic are Brachyspira hyodysenteriae, Brachyspira pilosicoli, and Brachyspira hampsonii. So you get a watery diarrhea with lots of mucus and sometimes blood. So you see only lesions of this bacteria in the colon, And then, if we see that, we go trying to diagnose it by culture or by PCR on the colonic content or on feces. It's a very important infection because once it's on the farm, it's very difficult to get rid of it. It stays infectious for a long time in the environment, and also rodents are a very important source of this bacteria. In this slide you can see the typical feces in Brachyspira enteritis. You see that there's a lot of mucus in it. That's typical for this infection. The last bacteria we are going to talk about is Lawsonia. Lawsonia intracellularis is a bacteria which multiplies within the cells of the intestine. It stimulates the cells to proliferate. So we have a thicker intestine with less absorption of nutrients. We have two forms in this disease. We have the chronic form with the thickened intestine, growth retardation, and we can have the acute form where you have a sudden bleeding within the intestine and mortality of the animal. We diagnose the disease by PCR on the feces or on the intestine because the bacteria is difficult to culture. And we can also look at histological lesions where we can see the thickening of the intestinal wall. To have an idea, I have two pictures of the chronic form, which is on the upper left. You see that the intestine is thickened, and in the lower right you can see the acute form. You also see the thickened intestine, but you see that there is blood within the large intestine next to it. So this animal is bleeding to death. Next to the bacterial problems, we also have parasites causing enteritis in pigs. The most important and most prevalent one is coccidiosis. It's a small intestinal parasite, Isospora, which infects the enterocytes, destroys those cells, destroys the intestinal wall, which is then covered by a crust. So there is less resorption of nutrients, which results in growth retardation in small piglets and diarrhea. A kind of pasty diarrhea mostly, not really watery. Diagnosis of coccidiosis is made by microscopy, where we see the parasites in scrapings or in feces. Very important in this condition is hygiene in maternity, because the parasite stays in the environment for a long time. Next to intracellular parasites, we also have worms. The most important nematode for enteritis in pigs is Trichuris. You also have Oesophagostomum, but it's less prevalent. When you have an infection with Trichuris, you have weight loss, diarrhea due to destruction, mechanical destruction of the intestinal mucosa. Especially in conditions where you have straw or outside environment where pigs have access to. The most important nematode in pigs, Ascaris sum, does not really give enteric problems. It's more important in weight loss, when there are a lot of them, in respiratory symptoms and in liver lesions. So when looking at helminths, mostly Trichuris is important for enteric infections. We have seen that there are very different viruses, bacteria and parasites causing enteritis in pigs. So you have seen it's very important to have a correct diagnosis, to be able to treat the animals correctly and to diminish the growth retardation they encounter due to enteric infections. Thank you for your attention.